There, this is Dr. Paul Firnhaber. It's Wednesday and time for another 10 minutes of truth. So as usual, this week I have another article from a major medical journal. Really important article, like all the articles I cover are pretty important. And this article is from the Journal of the American Medical Association, JAMA, July 7th of this year. It's about 3 weeks ago, so it's very, very recent article. The name of the article is Trends in U.S. Children's Mortality, Chronic Conditions, Obesity, Functional Status, and Symptoms. The objective of this study was to determine how U.S. children's health has changed from 2007 to 2023 as compared to 18 other high-income nations from the Organization for Economic Cooperation and Development. Basically, these countries are Australia, New Zealand, and all of Western Europe. It was a huge, huge study. The number of children in the U.S. was, they looked at 83 million children, and then 120 million children from all the rest of the countries, so Europe, Australia, and New Zealand. And the assessments included annual incidence for mortality and prevalence for chronic physical, developmental, and mental health conditions, functional status, and emotional symptoms. So the article starts off kind of interesting, made a couple of points that I think are obvious, but they're important. Child health sets the foundation of the overall health and prosperity of a nation. So if kids are sick, the nation's not going to do well. It says healthy children are more likely to become healthy adults who lead meaningful and productive lives. Well, yeah, and I think that's pretty obvious. Recent scientific and policy statements have raised concerns that child health in the U.S. may be declining. Well, if you're over the age of 55, you know that to be true. That's for sure. You don't even need a study for that. So the results of this study are pretty interesting and actually pretty shocking. It says infants less than a year old were 78% more likely to die in the U.S. than the other countries. 1-year-old to 19-year-olds were 80% more likely to die in the U.S. than in the other countries. The two causes of death with the largest net difference between the U.S. and those other countries, the OECD 18, were prematurity, which increased 122% in the United States between those dates of 2007 and 2025, 2007 and 2023. And sudden unexpected infant death syndrome increased 139% for infants 12 months or younger. For 1 to 19-year-old individuals, motor vehicle crash deaths increased 145%, which is pretty interesting. I think probably in those other countries is that, and I didn't say this in the article, but I'm just thought about this when I was looking at the article, probably not a lot of kids like, 16 to 19-year-olds, probably not nearly as many have cars in the other countries as they do here. And that may be the reason for the much greater number of deaths here. From 2011 to 2023, the prevalence of 3 to 17-year-old individuals with a chronic condition rose from 25.8% in the United States to 31% within the general population. So that was in the United States. So you're looking at 31% of kids in that range have a chronic condition. Well, this is way higher than it was like even in 2000. Rates of obesity early onset of menstruation, trouble sleeping, limitations in activity, physical symptoms, depression, and loneliness all increased during the study period. Across the 16-year period, the U.S. experienced an average or equivalent of an extra 54 excess child deaths per day. That's, compared to the other countries, that's a pretty staggering amount. A child in the U.S. in 2023 was 15% to 20% more likely to have a chronic condition compared with a child in 2011. The 8 conditions with the largest increases were major depression, sleep apnea, eating disorders, anxiety. Depression rose 230% in that period of time. Autism rose 162%, obesity, or disorders of lipid metabolism, and developmental disorders. Depressive symptoms significantly increased from 26.1% of 9th to 12th graders in 2009 to 39.7% in 2023. So from about 26 to 40%. That's a pretty big jump in that period of time. From 2007 to 2023, children's health in the U.S. steadily declined across mortality, chronic physical, mental, and neurodevelopmental conditions, functional status, and physical and emotional symptom domains. Nearly half of all the children receiving care had a chronic health condition. Obesity now affects 20% of children, and early puberty is increasing among girls, with 1 in 7 beginning menstruation before the age of 12. Obesity rates in 2 to 19-year-old individuals increased from 5.2% in 1971 to 74 to 19.3% in 2017 and 2018, and I'm sure it's quite a bit higher now. And if you go back to like 1966, 67, I bet the obesity rate was probably 3% back then. It wasn't very high. Childhood mortality rates in the U.S. were comparable with those with the OECD nations during the 1960s. So if you go back to the 60s, we're about equal with Europe, Australia, New Zealand, but became consistently higher in the 1970s, in the early 1970s. Autism prevalence increased markedly from fewer than 3 per 10,000 children in 1970 to greater than 30 per 10,000 children by the 1990s, which is about 1 in 333. But that was the 1990s. If you look at it now, and depending on who you read, it's about 1 in 60. So it's gone from 1 in 333 to 1 in 60. So it says the broad scope of this deterioration highlights the need to identify and address the root causes of this fundamental decline in the nation's health. Well, that's a pretty, that statement, I would say, is pretty typical of something that would come out of the Journal of the American Medical Association. We need to find the root cause of this because we really don't know them. Well, they don't know them because they don't want to know them, I believe. That's a pretty inflammatory statement. But the American Medical Association is not great at finding out root causes of anything when it comes to health. And there's so much information and so much research out there showing a lot of the root causes of why kids are dying early. Okay, why the health of our nation is so terrible. All you have to look at is the consumption of ultra-processed foods and the sugar consumption in kids. Look at the amount of toxicity that kids are exposed to. Look at the lack of exercise and the amount of time they spend on their phones and tablets. I mean, just those three things in and of themselves says an enormous amount of why these kids are dying like they are, why they're so unhealthy. So there's definite reasons why the United States is lagging behind so badly. And if this point that the article made is that child health sets the foundation of the overall health and prosperity of the nation, then we're in trouble. And I believe kids can be healthy. They should be healthy. They were pretty healthy when I was growing up, but they're not now. And so, Robert Kennedy was put in place to change some of this. I don't know how successful he's going to be because of the huge amount of money that big pharma and big food has and the stake that they have in all of this. But I think that it's not too difficult to figure out why kids are so unhealthy. And unfortunately, our healthcare system and our government is not addressing these issues very well at all, in my opinion at least. There's certain physicians, pretty well-known physicians they're trying to at least, but overall, not a lot is being done. Most of these problems that I talked about are treated as pharmaceutical deficiencies and not as the root cause of why they're actually happening. So, very disturbing study, a study that we really need to think about as far as what are we doing to our kids. So, if you have children, your kids don't have to be like this. They don't have to be unhealthy. They can be healthy. You have to be very intentional about it. And I know plenty of parents who have raised very healthy kids because they were very intentional about it. So the kids do not have to be unhealthy. Depending on, you need to feed them, whole, nutritious food, give them nutritious supplements, give them plenty of activity, stimulate their minds. They don't have to get sick. So hopefully you've learned something from this article, and I hope that you can communicate some of these truths with some of your friends. And if you have kids that are sick, that they're unhealthy, they haven't been well for a while, those are the people that we like to help here at Lincoln Disc Nutrition. And we would love to help your children. Just give us a call at 402-488-2220 here in Lincoln, Nebraska. And we'd love to be able to help any of your kids that are suffering from chronic illness. Until next week, we will see you then. Have a great week.